Welcome to Wellness Wednesdays, a web series where we examine how COVID-19 has impacted our healthcare system and what you need to know as you re-engage with your physician and get the healthcare you and your family needs in 2022.
Today on Wellness Wednesdays, I'm here to talk about emotional health and to emphasize the importance of realizing this is a normal thing. We deal with this every day, every person, all the time. I define emotional health as how we are dealing with the world at any given moment. There is a lot of talk about, separating how you're feeling physically with how you're feeling emotionally. There's also lots of terms about mental health and behavioral health. For me, it's all one thing. It can't be separated. How we are feeling emotionally is very, very much related to how we're feeling physically and about the behaviors we engage in. So I don't think it's easy to separate that from the idea of our general well-being and health. In terms of the pandemic, I think we all know this has been an unprecedented stressor on people personally and our society in general. The pandemic has cut off one of our most important things that ground us and help us to feel balanced, and that is our social connection. So many people have felt very isolated, even when you're at work. We are now doing so many things virtually that we don't have that face-to-face human interaction like we did before. The one silver lining that I try to see, I always try to look for a silver lining, is that we're talking more about this than we did before. And I really, really hope as we come out of this that we carry that with us, and we realize that the stressors of life, whether they're a pandemic or whether it's a relationship issue or whether it is just a bad day, those are all things that are okay to recognize and to talk about and to reach out to your support system to deal with before it becomes a crisis. Some of the top signs that a person is struggling can be anything. What I tell people is if you feel like something is not right, if you are feeling down all the time, if you are finding that you're crying often, if you feel lack of joy in life, if you are dreading going to work, if you are having physical symptoms like chest pain, headaches, indigestion, abdominal pain, any of those things can be signs that something isn't right. And it's important to reach out to your primary care doctor to talk about those things, to identify where can we pinpoint help so that we can take care of these things before it becomes a crisis. Certainly, if you're having feelings of self-harm or any of those kinds of things, it may be closer to a crisis point, and we may need to get more intensive help and do that more quickly. So certainly, if any of those things are happening, that is an emergency to reach out to help immediately. If you have further questions or concerns or need more information, you can find more information on our website.